And as we saw in this report, Africa's health sector is experiencing a multidimensional revolution largely based on new technologies. Our guest, CEO and co-founder of startup ZuriHealth, Ikechukwu Anoke, has not only understood this evolution, he has also decided to make it benefit the greatest number of people. He explained how to Laurent Soustras and Thierry Schiller.
Ikechukwu Anoke, welcome to Initiative Africa. You are the CEO of ZuriHealth, a virtual hospital and digital health platform. Please explain how it is revolutionizing healthcare in Africa.
Thank you very much. I like that question. So, ZuriHealth is, like you mentioned, a virtual hospital, and ZuriHealth combines both smart and not smart tools to ensure we provide access to healthcare in Africa. But it's important to understand what problem we're solving. One, we're solving a problem of doctor to patient. We have a doctor to patient ratio in Africa of 1 doctor to 10,000 people. And the idea is, how can we create an opportunity or solution that allows people in underserved communities to access doctors in areas where you have doctor surplus? And that is what we're using, leveraging telemedicine, SMS to a doctor, and basic tools to provide that access. The second problem we're solving is a problem of the fact that 65% of mobile phone users on the continent don't have access to the internet or smartphones. So our ambition as ZuriHealth is to put healthcare in every mobile phone, whether smart or non-smart. The third one is cost. Half of the continent live on less than $1 a day, which means that when you price healthcare above $1, most families cannot afford access to health. How can we come up with solutions that allows people to access healthcare at less than $1, making healthcare very accessible and very affordable? And that is very important because healthcare is a fundamental human right. So we're trying to solve that issue. And finally we're solving the issue of NCDs. Non-communicable diseases contribute 40% of deaths in Africa, but they are preventable diseases, manageable diseases. So how can we come up with solutions that allow for screening, solutions that allow for continuity of care, solutions for allow for insurance to ensure that people have a chance around NCDs. These are the problems that we're solving, and the way that we're solving them is what makes ZuriHealth a key stakeholder in revolutionizing access to health in Africa.
ZuriHealth was born out of a very personal experience that inspired its creation. Could you probably share a little bit more about it?
Thank you. I like to talk about it. ZuriHealth is a father's promise to a daughter. My daughter is named Zuri. Now, the circumstance of her birth, the challenges that we saw, and even at a position of privilege, seeing that struggle made me ask myself 3 questions. 1, I can afford access to health. I could afford to pay for the best doctors, but I almost lost my child. So what happens to people who do not have my privilege? Number 2, this needs to be dealt with from even a fundamental point of view. We need to take it to the basics. Fixing issues of healthcare should not be just, I want to make doctors available and accessible on time. Fixing issues of healthcare needs to go into making sure that everybody has a way of accessing health, even at the most basic, because it wasn't just childbirth. It's about people dying from malaria. It's about people dying from diabetes, hypertension. It's about women not having access to contraceptives and family planning. It's about a whole gamut of issues that is born from lack of access or information. And I also needed to look at how powerful healthcare information is. How can we empower people by understanding basic things around healthcare? And that is one of the reasons we built ZuriHealth of Africans.
You mentioned affordability. How do you manage to make Zuri affordable?
For us at ZuriHealth, we identified cost as one of the barriers stopping people from getting access to health. Health insurance companies keep making losses, struggling to earn a profit. So when it comes to issues like NCDs, where they are vulnerable, they need a partner who will leverage technology and other tools to ensure better adherence for treatment for patients, cheaper affordability in terms of medication for them. Now, how has ZuriHealth tackled this? ZuriHealth has tackled this by partnering with telcos, mobile operators in Africa, MTN Group, Safaricom, Telecel. What are we doing with them? We're partnering with them to ensure that people access healthcare at very affordable rates. And we're saying about 10 US cents daily. So essentially, the cost of talking to a doctor on ZuriHealth is cheaper than the cost of transportation from where you are to the nearest healthcare facility anywhere in Africa. And that is a huge barrier remover for access to health, because we've made this so affordable to get consultation that there should be no reason for you not to access healthcare.
Let's get back to this crucial issue of health financing and insurance. How can ZuriHealth concretely tackle the obstacle of the lack of access to healthcare?
Our insurance penetration on the continent is 3%. How can we increase it? We can increase it by coming up with solutions that allow people who earn less than $1 a day to afford to pay for insurance. ZuriHealth decided that we want to innovate around access to health from an insurance perspective, and that's why we built Care Now, Pay Later. But how can it get scale? We decided that telcos, mobile operators, have customers who they've aggregated over years, customers who they've built, millions of customers. Our group deal with MTN is 180 million subscribers across all MTN in 80. That is about 10% of the population in Africa. If we can get this number of people access to health insurance, provide them a means to pay little by little every day by month, that means you're going to add 10 more percent to insurance coverage to the 3%, looking at 13% insurance, and that is incremental growth. We can even do way more than that. Now, looking back, that solution is to ensure that people who do not have access to insurance can access insurance, a loan that will give them insurance, but an ethical loan. Because when loans are priced very high, you are causing more problems. You are putting the person in poverty trying to pay for a loan for access to health. No. We want to make it as affordable as possible, right, to ensure that people have access to insurance, because the goal is not to profit off the lending. The goal is to ensure that when you lend, that the risk is the risk debit, but most significantly, that more people have access to insurance.
How do you see AI integrating into health management?
Yes, so very great question. One of the things that we know AI will help is in the areas of lack of talent. When we talk about one doctor to 10,000 people, when we do about a specialist, whatever, it will maybe be one cardiologist to 200,000 people. We lack the specialists. And it's important for us to begin to understand that you're not going to, it's not like in the shop to manufacture specialists. That training, the cost of being able to get specialists will take way more time, and that we're also suffering from brain drain. Now, AI is going to help us bridge some of those gaps. And it is still a journey, because what I know in terms of being able to adapt AI fully for access to health it's still years ahead. However, we are beginning to look at it as a good companion tool for doctors, which means the doctor, specialist, cardiologist can be in Nairobi and with the help of AI support and treat triage patients who are dispersed in different parts of Kenya, similar to Nigeria, Tanzania, Senegal, etc. This is important.
ZuriHealth has previously partnered with the Timbuktu Pan-African Healthcare Accelerator. Now that many of these UN and US-sponsored programs are being undermined by Trump administration policies, what advice would you give to African startups?
We will now begin to look at homegrown solutions to tackle homegrown problems. We'll now look at how this could herald an era of improved collaborations, PPP, private-public collaborations between government and entrepreneurs. For entrepreneurs, businesses like ours, this could be an opportunity to begin to think beyond grants and beyond, how can we build sustainable business and move the hockey stick quickly towards profitability? What is the opportunity? The opportunity is in homegrown solutions. The opportunity is how to mobilize the resources of the continent. The opportunity is to begin to ask hard questions to policymakers and government. What are you doing with the resources that you're getting? The opportunities in cutting down cost and waste. So the correlation between creating a healthy society is very instrumental and very important in creating an economic activity that creates prosperity.
But when you discuss the matter with African financial institutions, private financial institutions, and private venture capital, are they on board?
Yes. So my experience, personal experience, that they are very on board, right? The appetite for grant has been dropped. The appetite for investment in terms of equity, safes, and whatever has dropped significantly. The appetite for loans have increased, which means more people are looking for catalytic capital, credit, loans to be able to grow. So we are seeing an uptick in loan, which means that the liquidity from those banks are being released to help spur innovation. So that is currently happening.
So with that in stock, what is ZuriHealth's Pan-African expansion plan?
Yes, ZuriHealth is always very keen on Pan-African expansion. Our idea is Africa to the world. We understand Africa very well. We are currently in 9 markets in Africa, and some of the Francophones, some of the Anglophones speaking countries. We want to take ZuriHealth to each of the 55 African countries within the next 3 years. Our idea is an African-built company that will go public, that is taking access to healthcare in major African cities and states, and ensuring that access to healthcare is something that it's a universal spoken word on the continent, unity of purpose towards a common goal. That the healthcare is a fundamental human right, that every African deserves access to affordable healthcare. And that is the message ZuriHealth intends to take to every city on the continent.